So the next motion we're going to measure is going to be wrist flexion and wrist extension. Typically in a clinical setting, there will be a desk between you and your patient. So in this instance, I offered a towel for our patient to rest their elbow on, just because just kind of going bare on that desk can be very uncomfortable. I like to cue my patients to get ready for an arm wrestling match. It's usually a funny and sure-feel way to get them to get in this position. If not, you can guide them manually. But essentially, we'll get into this position, and our bony landmarks are going to be identical for both flexion and extension. So our axis of rotation is going to be in line with the triquetrum of the wrist. So that's going to be on this pinky side. So just lateral to the triquetrum, it's going to be just proximal, just distal to the ulnar styloid process. Our stationary arm is going to bisect here into this forearm. You can point it towards the olecranon process of the elbow. And then our movement arm is going to be in line with the fifth metacarpal, so right here leading up to the pinky. So we'll have our patient kind of go into flexion as far as they can. We'll get our axis of rotation in here with the triquetrum, stationary arm pointing towards that olecranon process, and then our movement arm is going to follow that fifth metacarpal here on the pinky. And so in this instance, it looks like we're getting about 88 degrees of flexion. So now we're going to come and tell our patients to come into extension, so all the way back. We'll have a little less range of motion in this way compared to flexion, but the landmarks again stay the same. So just lateral the triquetrum for the axis of rotation, follow that olecranon, and then find that fifth metacarpal bone right there. And so that gets us a measurement of just about 59 degrees of extension, but that is how you measure wrist flexion and wrist extension.